stuck in a layer of mucus covering the olfactory epithelium. As they dissolve, they bind to the olfactory receptor cells, which fire and send signals through the olfactory tract up to your brain. As a side note, you can tell a lot about how good an animal's sense of smell is by the size of its olfactory epithelium. A dog's olfactory epithelium is 20 times bigger than your human one, but there's still a lot we don't know about smell types of sense too. For example, our olfactory epithelium is pigmented, and scientists don't really know why. But how do you actually tell the difference between smells? It turns out that your brain has 40 million different olfactory receptor neurons. So odor A might trigger neurons 3, 427, and 988, and odor B might trigger neurons 8, 76, and 2,496,678. All of these different combinations let you detect a staggeringly broad array of smells. Plus, your olfactory neurons are always fresh and ready for action. They're the only neuron in the body that gets replaced regularly, every 4 to 8 weeks. Once those neurons are triggered, the signal travels through a bundle called the olfactory tract to destinations all over your brain, making stops in the amygdala, the thalamus, and the neocortex. This is different from how sight and sound are processed. Each of those signals goes first to a relay center in the middle of the cerebral hemisphere, and then out to other regions of the brain. But smell, because it evolved before most of your other senses, takes a direct route to these different regions of the brain, where it can trigger your fight or flight response, help you recall memories, or make your mouth water. But even though we've all got the same physiological setup, 2 nostrils and millions of olfactory neurons, not everybody smells the same things. One of the most famous examples of this is the ability to smell so-called asparagus pea. For about a quarter of the population, urinating after eating asparagus means smelling a distinct odor. The other 75% of us don't notice. And this isn't the only case of smells differing from nose to nose. For some people, the chemical androstenone smells like vanilla. To others, it smells like sweaty urine. Which is unfortunate because androstenone is commonly found in tasty things like pork. So with the sweaty urine smellers in mind, pork producers will castrate male pigs to stop them from making androstenone. The inability to smell a scent is called anosmia, and there are about 100 known examples. People with alicin anosmia can't smell garlic. Those with eugenol anosmia can't smell cloves. And some people can't smell anything at all. This kind of full anosmia can have several causes. Some people are born without a sense of smell. Others lose it after an accident or during an illness. If the olfactory epithelium gets swollen or infected, it can hamper your sense of smell, something you might have experienced when you were sick. And not being able to smell anything can mess with your other senses too. Many people who can't smell at all also can't really taste the same way the rest of us do. It turns out that how something tastes is closely related to how it smells. As you chew your food, air is pushed up your nasal passage, carrying with it the smell of your food. Those scents hit your olfactory epithelium and tell your brain a lot about what you're eating. Without the ability to smell, you lose the ability to taste anything more complicated than the 5 tastes your taste buds can detect: sweet, salty, bitter, sour, and savory. So the next time you smell exhaust fumes, salty sea air, or roast chicken, you'll know exactly how you've done it, and perhaps be a little more thankful that you can.
If you struggle and struggle and struggle with CPAP, you should check out Inspire. No mask, no hose, just sleep. Inspire, sleep apnea innovation. Learn more and view important safety information at Inspire.
The sinuses are a series of interconnected hollow spaces in the skull. Their walls are lined with mucus-secreting membranes. Small hairs sweep the mucus out of the sinuses so it can drain out through your nose. These mucous membranes may become infected or inflamed because of a cold or allergies and can swell up and block the nasal passages so that the fluid from the sinuses can't drain. Buildup of fluid in the sinuses causes pressure and pain. Doctors call this sinusitis. Acute sinusitis comes on quickly and then leaves. With chronic sinusitis, people have symptoms virtually all the time and take many courses of medications such as antibiotics to treat the inflammation. Severe sinusitis may require surgical opening of the passageways with rigid steel instruments placed up through the nostril to remove bone and tissue blocking the drainage. Recently, a new less invasive technology called balloon sinuplasty has been introduced. Using this technology, a balloon catheter is delivered to the blocked passageway and is gently inflated, widening the opening of the passageway and thus allowing drainage and relief from the pain and pressure.
Nestled in the tissues of your neck is a small, unassuming organ that wields enormous power over your body. It's called the thyroid. Like the operations manager in a company, its role is to make sure that the cells in your body are working properly. It does that by using hormones to deliver messages to every single one of them. This high-ranking organ is made up of lobules that each contain smaller cells called follicles, which store the hormones the thyroid sends out into your blood. Two of the most important hormones it produces are thyroxine and triiodothyronine, or T3 and T4. As messengers, the hormone's job is to instruct every cell in the body when to consume oxygen and nutrients. That maintains the body's metabolism, the series of reactions our cells perform to provide us with energy. This hormonal notification from the thyroid gets the heart pumping more efficiently and makes our cells break down nutrients faster. When you need more energy, the thyroid helps by sending out hormones to increase metabolism. Ultimately, the thyroid allows our cells to use energy, grow, and reproduce. The thyroid is controlled by the pituitary gland, a hormonal gland deep in the brain that oversees the thyroid's tasks, making sure it knows when to send out its messengers. The pituitary's role is to sense if hormone levels in the blood are too low or too high, in which case it sends out instructions in the form of the thyroid-stimulating hormone. Even in this tightly controlled system, however, management sometimes slips up. Certain diseases, growths in the thyroid, or chemical imbalances in the body can confuse the organ and make it deaf to the pituitary's guiding commands. The first problem this causes is hyperthyroidism, which happens when the organ sends out too many hormones. That means the cells are overloaded with instructions to consume nutrients and oxygen. They become overactive as a result, meaning a person with hyperthyroidism experiences a higher metabolism, signaled by a faster heartbeat, constant hunger, and rapid weight loss. They also feel hot, sweaty, anxious, and find it difficult to sleep. The opposite problem is hypothyroidism, which happens when the thyroid sends out too few hormones, meaning the body's cells don't have as many messengers to guide them. In response, cells grow listless and metabolism slows. People with hypothyroidism see symptoms in weight gain, sluggishness, sensitivity to cold, swollen joints, and feeling low. Luckily, there are medical treatments that can help trigger the thyroid's activities again and bring the body back to a steady metabolic rate. For such a little organ, the thyroid wields an awful lot of power. But a healthy thyroid manages our cells so effectively that it can keep us running smoothly without us even noticing it's there.
In your life? Do you feel embarrassed, isolated, tired of having to constantly reassure others that you're not sick? Have you managed your symptoms with medications and sprays only to have them return? If this all sounds familiar, you may be suffering from chronic rhinitis, a common condition that affects over 30 million people in the U.S. alone. Chronic rhinitis occurs when abnormal nerve signals in the nasal cavity cause inflammation and excessive mucus production, leading to a persistent runny nose, postnasal drip, congestion, coughing, itching, and sneezing. Luckily, there's now a non-invasive treatment for chronic rhinitis that can be performed right in your doctor's office with minimal discomfort. The Rynair procedure from Aran Medical uses temperature-controlled energy to disrupt those abnormal signals and offer you long-lasting relief with zero downtime. That lasting relief means an improved quality of life and a significantly reduced need for tissues and expensive over-the-counter medications. In fact, a recent survey showed that 96% of Rynair patients experience substantial relief from their chronic rhinitis symptoms. So don't let a runny nose run your life. Ask your doctor if the Rynair procedure from Aran Medical is right for you.
Vivair is an innovative way to provide your patients with lasting relief from nasal airway obstruction by treating and remodeling all three components of the nasal valve without precluding the possibility of a future nasal surgery. Using temperature-controlled radiofrequency energy, Vivair treats nasal airway obstruction and nasal valve collapse to significantly increase airflow by increasing the radius at the most narrow part of the internal nasal valve. In contrast to alternative treatments, such as surgical intervention, the Vivair procedure is non-invasive, incisionless, and office-friendly. To perform the procedure, apply gel to the tip of the Vivair stylus and insert to treat the caudal edge of the upper lateral cartilage. Apply pressure anterior to the nasal bone and maintain a 4 mm lateral deflection, or about the width of a stylus head. Initiate the 30-second treatment cycle by holding the foot pedal and maintaining lateral deflection. You'll hear the console beep twice after 18 seconds of heating, and again after 12 seconds of cooling. Continue along the treatment zone of the upper lateral cartilage, being careful not to overlap treatments. Apply treatment if needed to the inferior turbinate and septal swell body, applying mild pressure to the head of the inferior turbinate to treat hypertrophy, and to the septal swell bodies along the anterior portion of the septum. After being treated with Vivair, patients reported significant improvement in nasal breathing, sleep quality, and other quality of life measures through 2 years post-treatment. Connect with us today to learn how to bring Vivair into your practice.
The sinuses are a series of interconnected hollow spaces in the skull. Their walls are lined with mucus-secreting membranes. Small hairs sweep the mucus out of the sinuses so it can drain out through your nose. These mucous membranes may become infected or inflamed because of a cold or allergies and can swell up and block the nasal passages so that the fluid from the sinuses can't drain. Buildup of fluid in the sinuses causes pressure and pain. Doctors call this sinusitis. Acute sinusitis comes on quickly and then leaves. With chronic sinusitis, people have symptoms virtually all the time and take many courses of medications such as antibiotics to treat the inflammation. Severe sinusitis may require surgical opening of the passageways with rigid steel instruments placed up through the nostril to remove bone and tissue blocking the drainage. Recently, a new less invasive technology called balloon sinuplasty has been introduced. Using this technology, a balloon catheter is delivered to the blocked passageway and is gently inflated, widening the opening of the passageway and thus allowing drainage and relief from the pain and pressure.
perfumes, coffee. For most of us, smells are simply part of everyday life. Not for Joy Mill.
Oh, thank you.
This grandmother from Scotland has such a sensitive nose, she can smell disease. An incredible ability, verified and published in scientific journals, where she's known as the super smeller.
It was somewhere between a dog and a human. And I take that as a compliment.
Joy, a nurse, says she's always smelled changes in her patients, but it was a change in her husband Les, a doctor, that would alter both of their lives.
He was only 31, just going on 32. It was that summer.
Les didn't smell like himself, and the odor wouldn't go away.
I thought, well, I'm not going to nag about this.
More than a decade later, at 45, Les was diagnosed with Parkinson's. The disease actor Michael J. Fox has battled for years. Muhammad Ali had it too. It causes tremors and eventually dementia. At Les's very first support group meeting, Joy's nose was overwhelmed.
And I said, look, everybody else in that room with Parkinson's has the same smell as you. And he just went, what? What on earth are you talking about?
University of Manchester biotechnology professor Perdita Barron was skeptical. So she and a team of researchers tested Joy, not with high-tech machines, but T-shirts.
Well, we got some people with Parkinson's, 6 people, and 6 people who didn't have Parkinson's, and we bought them identical T-shirts and they wore them overnight.
They gave the shirts to Joy, and she sniffed out all of the Parkinson's patients, plus one T-shirt in the control group. 9 months later, that person was told he had Parkinson's.
That was really transformative. No, some other person had it before they were clinically diagnosed.
Once symptoms like tremors start, the damage to the brain is already irreversible. Joy could be the key to catching it early.
So what does Parkinson's smell like?
It's a very musky, thick, greasy odour. It's not pleasant.
But a lot of scents make her smile. She tried to teach me how to really stop and smell the flowers.
I can definitely smell the floral on the blossom.
Never just smell once, because smells are not one smell.
So now you're smelling
The chlorophyll, the basic molecules.
A molecule.
Yes.
She smells molecules from people, too.
That's the cardboard smell.
With Joy's help, researchers pinpointed the Parkinson's smell to sebum, the oily substance in the skin, and identified molecules specific to the disease. The result, a groundbreaking new test.
We can tell within about half an hour from a patient sample, just a swab, whether someone has Parkinson's or not.
That test is still in early trials, but if it works, it could save countless families from the pain Joy and Les went through. He died 4 years ago.
What do you think he would think about what's happening
I keep on saying to people who ask me that, it's the tearjerker. No, he would be just over the moon.
An extraordinary ability that one day might lead to a cure.
Pull. Oh, it opened. Was that all you were using Leroy for? Whoa!
Watching the size, I think it feels good on her teeth and all.
It's so hard to eat that I have to keep on eating it.
You hear the gentle lap of waves, the distant cawing of a seagull, but then an annoying whine interrupts the peace, getting closer and closer and closer until, whack! You dispatch the offending mosquito and calm is restored. How did you detect that noise from afar and target its maker with such precision? The ability to recognize sounds and identify their location is possible thanks to the auditory system. That's comprised of two main parts, the ear and the brain. The ear's task is to convert sound energy into neural signals. The brain's is to receive and process the information those signals contain. To understand how that works, we can follow a sound on its journey into the ear. The source of a sound creates vibrations that travel as waves of pressure through particles in air, liquids, or solids. But our inner ear, called the cochlea, is actually filled with saltwater-like fluids. So the first problem to solve is how to convert those sound waves, wherever they're coming from, into waves in the fluid. The solution is the eardrum, or tympanic membrane, and the tiny bones of the middle ear. Those convert the large movements of the eardrum into pressure waves in the fluid of the cochlea. When sound enters the ear canal, it hits the eardrum and makes it vibrate like the head of a drum. The vibrating eardrum jerks a bone called the hammer, which hits the anvil and moves the third bone, called the stapes. Its motion pushes the fluid within the long chambers of the cochlea. Once there, the sound vibrations have finally been converted into vibrations of a fluid, and they travel like a wave from one end of the cochlea to the other. A surface called the basilar membrane runs the length of the cochlea. It's lined with hair cells that have specialized components called stereocilia, which move with the vibrations of the cochlear fluid and the basilar membrane. This movement triggers a signal that travels through the hair cell. into the auditory nerve, then onward to the brain, which interprets it as a specific sound. When a sound makes the basilar membrane vibrate, not every hair cell moves, only selected ones, depending on the frequency of the sound. This comes down to some fine engineering. At one end, the basilar membrane is stiff, vibrating only in response to short wavelength, high-frequency sounds. The other is more flexible, vibrating only in the presence of longer wavelength, low-frequency sounds. So the noises made by the seagull and mosquito vibrate different locations on the basilar membrane, like playing different keys on a piano. But that's not all that's going on. The brain still has another important task to fulfill, identifying where a sound is coming from. For that, it compares the sounds coming into the two ears to locate the source in space. A sound from directly in front of you will reach both your ears at the same time. You'll also hear it at the same intensity in each ear. However, a low-frequency sound coming from one side will reach the near ear microseconds before the far one, and high-frequency sounds will sound more intense to the near ear because they're blocked from the far ear by your head. These strands of information reach special parts of the brainstem that analyze time and intensity differences between your ears. They send the results of their analysis up to the auditory cortex. Now the brain has all the information it needs, the patterns of activity that tell us what the sound is, and information about where it is in space. Not everyone has normal hearing. Hearing loss is the third most common chronic disease in the world. Exposure to loud noises and some drugs can kill hair cells, preventing signals from traveling from the ear to the brain. Diseases like osteosclerosis freeze the tiny bones in the ear so they no longer vibrate. And with tinnitus, the brain does strange things to make us think there's a sound when there isn't one. But when it does work, our hearing is an incredible, elegant system. Our ears enclose a fine-tuned piece of biological machinery that converts the cacophony of vibrations in the air around us into precisely tuned electrical impulses that distinguish claps, taps, sighs, and flies.
Just for this.
Let's go! Let's go! Make sure there's no sleep in it. Did you get that?
He want to play with it.
Give me more. Oh, baby. Do you want more?
You want more?
Oh, but you just keep coming back.
Baby stoat that's been lost. She would be normally in a litter, maybe 6, 7, 8. Giving her milk when she was tiny. It was a really delicate operation. Really wobbly. She's just got one eye open, so that indicates she's 5 weeks old. As you can see, she's got a really fat little tummy there. So she's got her own little sleeping bag in here, and she's going to be nice and cosy in there. Whisper's coming on really well, just going really fast now. Alright, it's time for a bigger enclosure for her. She'll come out and she's going to have a whole new little world to explore in there. There we go, she's getting braver. The main thing it likes is human company. That's something that we've got to change. I feel a little bit sorry for her in a way that she's not got any playmates yet. We're always on the lookout for another stoat kit that's been lost, and if we find one, we'll do everything we can to get them together. Someone contacted me from Norfolk. They found a baby stoat in their garden, and with a few phone calls and a bit of driving, they've actually got the baby stoat here. So there we are, exactly the same age as Whisper. This one's quite shy, and it's called Stuart. Stuart's a girl. And I'm going to pop her in now with Whisper, and we'll see what happens. Neither of these have seen the stoat before because we were both found with our eyes closed. So this is going to be a really exciting moment. Here comes Stuart just having a little look out, and we've got Whisper exploring around the back. I'm sure this is going to work. There, they're just calming down a bit now. So this is it, they've been in there less than half an hour together, and we've got them playing. They've realised they've got a playmate now, which is just superb. They're getting really active now, they're climbing, they're fighting, they're playing. They're really ready for the next part of their development, which is going outside into the release enclosure. Right, that's it. We've got two stoats in here now, and we're just going to walk out to the enclosure. So I'm going to put the stoats into the nest here, but we've got loads of places to explore here. We've got the dry stone wall here. So we've got a little nose poking out here, so they're really raring to go. Stuart was cautious, just popping her head out of the wall, sniffing at the air. Whereas Whisper's much more confident, straight out exploring a new enclosure. Over the next few days they became more and more confident and started playing in this enclosure, which was just fabulous to see. It was great to see some rivalry between the two kids. Whisper had some food, and a hungry Stuart tried stealing it. I even built them a pond. It was absolutely brilliant watching them swim around, playing and fighting in the pond. And now I'm pretty confident they're ready for their next stage, which is life in the wild. Stuart was first to appear, sniffing around at the entrance. Eventually, she takes her first cautious steps into the wild. Whisper and Stuart stayed in and around the enclosure for about a week before setting off for their new life in the wild. It's been an amazing experience being part of these young stoats' lives, and I look forward to catching up with them in the future.